Actually brought my kid to see his own pediatrician today, and she was saying that she's seeing a lot of RSV, and we both agree it seems to be a little bit more severe this year than it has been in past years.
If you have a young child, perhaps you've heard about RSV. That's a respiratory illness that's hitting a lot of families hard right now. And doctors say they expect to see cases through March. Fox 12's Kelsey Watts spoke with a doctor about the warning signs you should watch out for.
Numbers from the Oregon Health Authority show the scale of this illness right now. In the last week of December, they say 322 people across Oregon tested positive for RSV. And unfortunately, it can be especially dangerous for young kids.
Hi, Papa. Good morning.
Sawyer Cole is only 3 months old, and right now he's doing everything he can to simply breathe. He's in the hospital at Providence St. Vincent fighting RSV, a respiratory illness that can be serious in young kids. His parents, Sarah and Brian, tell us he started getting a little cough on Thursday. They thought it was a cold, but it only got worse.
It was Monday morning, I think, is when we woke up and he just was coughing crud up and just kept having hard problems breathing and stuff, so we took him to the doctor.
We're seeing quite a bit of RSV here in the hospital.
Dr. Patrick Liu has seen a lot of RSV cases lately. He says in the last week, as many as half of the pediatric patients at this hospital have had it. Early signs do start like a cold, things like runny nose and congestion, maybe a fever. But in some cases, that congestion can be severe. You can see little Sawyer using his belly to breathe. That's one of the signs your child is in respiratory distress and needs to see a doctor.
It's most severe in the really young kids. So the younger you are, the harder it's going to hit you. And those are the kids we worry most about.
Other signs include nostrils flaring when your child breathes, fast breathing, or the skin around their neck or ribs being sucked in as they inhale.
Had you ever heard about RSV before this?
I have, yeah. I worked in daycare for a while, and so I was pretty familiar with it. But we just hoped he wasn't going to get it.
Sawyer's parents say he's doing a little better today, but still has a fever and doesn't want to eat, so they may have to stay here a while longer. Their message for other parents is this: if your child is sick, don't wait to bring them in for treatment.
We were kind of apprehensive, like, oh, do we need to take him in? Do we not? And I probably wouldn't. If I know now, I would have brought him in a lot sooner.
Unfortunately, there is no vaccine for RSV, so Dr. Liu says the best prevention is good hand washing, covering your cough or sneeze, and trying to stay away from people who are sick. If you have questions about your own child's health, call your doctor. Reporting in Southwest Portland, Kelsey Watts, Fox 12 Oregon.